Let's talk about mastitis. So, firstly, what is mastitis? This is the inflammation of breast tissue, and it often occurs with breastfeeding mothers. And it can result from a blocked milk duct or bacteria entering the breast, or really a combination of many different factors. And often it presents with things like breast pain, swelling, redness, and sometimes a fever in cases where it is caused by a bacteria. And so it's important to recognize early symptoms for mastitis, especially if you're a woman postpartum, and deploy certain strategies with combating this problem. So, certain strategies that you can deploy at home to manage or prevent mastitis is to ensure proper latching for the baby. It's crucial that the baby should be able to, you know, latch properly to your nipple and really get access to the breast milk. And in situations where you're not breastfeeding, for example, you would need to have to pump out the breast milk to discard or store or whatever sort of situation you're in, but you cannot not void your breast if you are postpartum. And another thing is to just ensure that you continually breastfeed your child, rotating from breast to breast to ensure that, both breasts are emptied on a regular basis. And in cases where this may persist, it's encouraged to practice warm compress and massages, which can help alleviate some of the pain and also encourage milk flow by enlarging your milk ducts and facilitating milk flow. In cases as well where it may be a more serious case, it's always important to seek medical help. So, if you suspect that you may be having this or if you're experiencing more persistent symptoms, it's crucial to contact your healthcare provider or your lactation specialist provider. And certain times you may have to be put on antibiotics, and if that's the case, it's important that you complete the full course of antibiotics as prescribed by your healthcare provider. So, in any case, if you have mastitis or if you're recovering from it or if you're trying to manage it at home, it's really just important to make sure that you are well rested, well hydrated, practice warm compresses and massages, and communicate regularly with your healthcare team.